I'm Vanessa Ho, and I'm a trauma surgeon at Metro Health in Cleveland. And I am also the committee chair of the EDIC committee, the Equity, Diversity, and Inclusion Committee here at Center. So I also have a tight 5 minutes, so I'm going to get started talking about DEI centrality to successful change making. So I wanted to start by thanking Dr. Legron and Center for the opportunity to introduce a key topic for today. We are all acutely aware of the devastating impact of traumatic injuries on people, their families, and their communities. In 2022 alone, over 218,000 Americans lost their lives from an unintentional injury, with an additional 70,000 from suicides and homicides. So these numbers only scratch the surface of the true scope of what trauma's impact is. Millions more sustain injuries that require medical attention, leading to significant healthcare costs and lost productivity. And we all want to achieve zero preventable deaths and support the individuals who survive. But we also need to support implementation science, getting the treatments out that we already know work. We have to get them out into the world. And I'm speaking today to start the conversation that successful implementation is intrinsically intertwined with a commitment to diversity, equity, and inclusion. So why is DEI so crucial to the success of implementation projects? The answer is simple. Without conscientious consideration of DEI principles at every step of the implementation process, our endeavors are destined to falter. So in August, we convened a group of DEI-focused trauma researchers for the Summit for the Advancement of Focused Equity Research in Trauma, also known as Safer Trauma. And I would encourage you to learn more about this conference at the QR code on the screen. So research has shown time and again that individuals from socially disadvantaged backgrounds are disproportionately affected by traumatic injuries. They face barriers in access to care, they receive inferior treatment, and suffer greater financial burdens as a result of their injuries. But beyond this, these disparities also exact a heavy toll on physical and mental well-being and lead to long-term functional decline, mental health disorders, and reduced quality of life overall. So these disparities are not just unfortunate coincidences. They are symptoms of systemic inequities that pervade our entire society. So how would we be able to say that implementation of any solution was truly effective if it continued to leave some behind? Implementation and DEI must go hand in hand. So I show here the roadmap to drive progress towards equity and trauma research that we developed at Safer Trauma. Any research on trauma, including and especially implementation, must include diversity. The drive to do this is not only from a moral imperative, because it is the right thing to do, but we should also keep in mind that we must cultivate an economic argument as well, focusing on sustainability, which is a key implementation outcome. As discussed at Safer Trauma, in order for this work to stick, it must not only pull at our heartstrings as human beings, but also at the purse strings of the organizations with the influence to drive national and international change. We already possess the knowledge and the evidence base to drive meaningful change in trauma care. We already know what works. We already know what interventions are effective in improving outcomes and saving lives. The time is now to implement those solutions effectively and equitably for everyone. So I want to thank you for the opportunity to introduce this very important topic, and I look forward to hearing our speakers today and tomorrow. Thanks.